We will now have a look at the surgical protocol for an FDOJ. First of all, what is an FDOJ? It is a fatty degenerative osteonecrosis of the jawbone. Often we find it in the wisdom tooth area when a wisdom tooth was pulled and the bone couldn't heal correctly. We also find it around root canal treated teeth, infected teeth, and also titanium implants. The problem with the FDOJ is the systemic effects that it has, the negative effects on our systemic health, that I will explain shortly in a second. Here you see a histological picture of an FDOJ. It was from a patient that had a trigeminous neuralgia all his life, suffered a lot. When he died, he asked the doctors to get a probe of this area because he thought something is there and nobody believed him. And when they had a look at it, they could see that the bone was degenerated in this area and that this was probably the cause for his trigeminous neuralgia. We have a problem with these areas. They have a constant release of inflammatory mediators, and that is RANTES. RANTES is one cytokine that is constantly 24 hours, 7 days a week high in these areas. We know that from analysis of multiplex analysis from laboratories. And what does RANTES? It is a normal cytokine that everybody has in his body, and it goes up if you have a wound, an open wound, for example. It is a chemotactical mediator, so it triggers the immune system to bring lymphocytes, granulocytes to heal this wound. Once the wound is healed, it goes down again. So it is a marker for a wound, for a chronic wound. In this case, when we have a constant release of RANTES, that means the body gets a constant information that we have a wound, and it's constantly sending inflammatory markers or healing cells to this area. So the immune system is constantly triggered by this high RANTES. And we know from the medical, from many, over 10,000 medical studies, that higher RANTES levels in the blood are related to diseases like MS, arteriosclerosis, arthroid rheumatitis, also autoimmune diseases, depression, chronic fatigue syndrome, cancer, many diseases, and still the medical field does not know where this higher RANTES level come from. We know, at least in these jawbone areas, and especially for patients who have these diseases, we need to look at these jawbone areas and clean those so that we don't have these constant RANTES levels in these patients. Also, the fibroblast growth factor is elevated. So this is a constant release and causes these diseases that I just named and can promote them. Here you see a surgical protocol of an upper osteonecrosis. You see that you often have a fatty blood or yellow fatty solution that you need to clean. Often there is no good blood support in these areas. Once you've cleaned it out, the blood comes and then you have to look or have to make sure that there are no fatty eyes on this blood anymore. That's a sign that you clean it correctly. It's very important in the tuberous area to really clean everything and also remove the palatal bone, the buccal and the distal bone so that you don't have a recurrent NICO. We also disinfect the area with ozone, and we supply the area with blood concentrates, PRF, so that we have an accelerated wound healing and a better bone regeneration. And then it's important to make a tight suture to cut out over excessive tissue or use a laser for it, whatever you prefer, and really have a tight gingiva around your last tooth so that you don't have an infiltration or penetration of bacteria around this tooth. And that helps our patient to prevent or take a part in the prevention of these diseases, or also help them when they have these diseases that therapies work better. This is the multiplex analysis of the cytokine profile, and you see that the Rantes level, would be a normal Rantes level in a normal healthy bone. This is the Rantes level they found in over 128 probes of patients. It is 35-fold higher than usually, with over 5,218 picogram. What we also see is that this is elevated. It's the interleukin-1 receptor antagonist. Interleukin-1 is an acute cytokine. That means it induces an acute inflammation with the reaction of an edema, of swelling, of pain, of heating up of the area. So this interleukin-1 is depressed, and that shows us, or that's why patients often don't feel pain. Some have a chronic trigeminous neuralgia, but most patients, it's no acute inflammation, it's a silent chronic inflammation, because the acute inflammatory markers are depressed. Also, we have a very low level of interleukin 6 and 8, which are also acute inflammatory markers. And whenever a patient asks you, why don't I have pain, why don't I feel it? Yeah, the acute inflammatory markers are depressed down, and the chronic markers are high. It's kind of like a periodontitis. Patients don't feel pain, but their body, their bone resorbs, and their teeth get loose, and it's not a painful disease, and it's the same with our FDOJs.